How's it going, professors? AJ Freund here, doing the simulation for the medication administration. So just jumping right into it here. I would walk into my patient's room, hand hygiene, greet my patients, see how they're doing, and then I would proceed to confirm their name and date of birth. I don't have anybody here with me to do this with, so it looks like I will be flying solo and doing the best I can for you. Be confirming their name and date of birth. In this case, it is Thomas Smith, and his date of birth is 3/14/19XX. I remember it like it was yesterday. And then after that, I would confirm his allergies. In this case, this patient is allergic to sulfa. And then afterwards, I would do vitals. So in this case, I would check temperature, read all like the pulse, respirations, and check BP on the monitor here. Check BP by pushing a little button and making sure that it is in fact over 100. Let's see, after that, I would also confirm that their glucose is under the 111 mark in the range here. So to make sure to confirm whether or not insulin is indicated for this patient. So if I were to do blood pressure, let's say for the sake of simulation, his blood pressure was 124. Perfect, great. It's over 100. So that means that we can do the lisinopril. So after that, I would ask him if there was anything else I could do for him before stepping out to grab all the medications, and then perform all those actions as requested. Then I would step out. I would go to my Pyxis, and then once I'm at the Pyxis, I would log in. After logging in, I would take my MAR, and I would confirm that yes, this is Thomas Smith, 3/14/19XX, MAR to Pyxis. Yes, and then select him. Okay, we are in his file now, and so we are going to be pulling several medications from here. So we're going to be doing fluticasone, 100 micrograms, salmeterol, 50 micrograms, 1 puff daily. Looking on the MAR, comparing to the Pyxis, make sure that those two match up, and then I would select that, boom, pull it, have our medication here, confirm medication to Pyxis, fluticasone, 100 micrograms, salmeterol, 50 micrograms, here comparing to Pyxis, make sure those match up, and then I would take one of his labels and put that on there. Set that aside. Next one up is going to be lisinopril. So this one, I know that comes in is going to come in a 10 milligram tablet. So this one is 20 milligrams per oral. And let's see, so now I'm going to go looking again from MAR to Pyxis. Lisinopril, 20 micrograms per oral daily. I am looking on the Pyxis. Lisinopril, 20 milligrams per oral daily. Looking on the Pyxis, 20 milligrams per oral daily. Select two of those, and now I'm going to get 2 of these tablets here. Looking here, medication, yes, this is in fact lisinopril, 20 milligrams worth, lisinopril, 20 milligrams worth. After that, we are taking label, putting it on here. Awesome, it is there, labeled up, set aside. Third medication, heparin, 5,000 units per milliliter subcutaneous. Looking on the MAR, looking on the Pyxis. Okay, heparin 5,000 units per milliliter. Heparin 5,000 units per milliliter. Sweet. Now I'm going to select that one, pull it. Here we go. Looking at the medication, heparin 5,000 units per milliliter. Pyxis, heparin 5,000 units per milliliter. Great, it all matches up. After that, we take our third and final label and put it on. Actually, I'm going to put it on top here. Sweet. Now we have our medications. I'm going to log out. Afterwards, step away, go back to my patient's room. Once I'm back in the patient's room, I am going to hand hygiene once more, and then I'm going to grab some gloves because I know that I'm going to be working, possible exposure to bodily fluids. Again, but I'm going to confirm that, yes, this is confirm his name and date of birth again, those 2 patient identifiers, because I did step out and anything can happen in that time. So I'm going to confirm, yes, Thomas Smith, he is 3/14/19XX, and I'm also going to confirm that on his little name tag, or his little wristband here. So once I've confirmed that there, I'm going to reconfirm that, yes, does have an allergy to sulfa. Does that sound about right? Yes, that does sound about right. Okay. And then our blood sugar was under 111, was still out of that range, correct? Yes, blood sugar is still out of that range. Let's say for the sake of simulation, it's 100. Great. Not in the range. Insulin is still not indicated. Okay, so now we're gonna actually get into the good stuff. So I'm actually gonna start, I'm gonna gather all my supplies together, tell the patient, okay, yeah, I'm starting your medications now. Let's start with the heparin here. Going to put that aside there. Okay, 2 supplies. Again, I do have gloves on. And then I'm going to confirm that I'm going to start going through my 5 rights. This is my correct patient, Thomas Smith. Thomas Smith on the label that I just pulled that was on here that I carelessly put aside. Thomas Smith, 314-19XX. This is the correct medication, comparing medication to the MAR. Yes, it is heparin, 5,000 units per milliliter. That's the dose, the route, subcutaneous. Yes, the time, every 8 hours, and this is due at 0800. Great. A little bit of a time crunch right now. Okay, so let's get to it. I'm going to be explaining to the patient, yes, this is heparin. This is a antithrombolytic. I'm just going to be giving it to you through your abdomen. And so I'm just kind of explaining everything that heparin is used for, kind of looking out for some adverse effects such as fever that can come about from it. Reconfirming if he's okay. So that's the last thing we want is for him to not be okay. Awesome. Okay, and then we want 1 milliliter, so here we go. Nice. Okay, this is where the fun begins. Okay, now we're off. We are drawing the heparin. Everything looks good so far, so good. And there's only so much a video can sell. There we go. Make sure that I get that full dose, 1 milliliter. Okay. Still drawing out. And there we go. Got our 1 milliliter here. Being very careful with this needle. Since we do not have the other attachment in my kit, I'm about to resort to this. So for the sake of simulation, I also want to make sure, confirm that with another nurse, that this is in fact, before I do give it to Mr. Smith here. Hey, Rita, do I have heparin, since this is a highly classified, well, not highly classified, specialty drug. Want to make sure that I do have heparin, 5,000 units per milliliter here for Mr. Smith. Okay, she has confirmed it. Do that before we give this medication, right before. Sorry, Rita. Back on track. Medication here. For the sake of simulation, I do not have anybody to inject this into, so I'll be taking matters into my own hands. Want to make sure we pinch up 2 inches away from the umbilicus. Make sure we pinch up. Since this is a longer needle, I would normally go in 90 degrees, but for the sake of my skinniness, probably 45 would have to do. So you're gonna go up, the skin here, ready here. Just kidding. I'm not actually gonna inject myself, no. Normally what I would do is I would go up to the patient, use an alcohol prep pad, wipe away, clean the area that we are going to be working with. Pinch up, inject, and hold for 5 seconds. Let's just say that this is it. Inject, administer, 1, 2, 3, 4, 5, and release. Okay. Needle covered up. Sharps container. Done with the heparin. Okay, moving on to the lisinopril. Oral medication. Again, correct patient, according to the tag here. Yes, this is Thomas Smith, 314, 19XX. Right patient, right medication, lisinopril, right dose, 2 tablets, so that's 20 milligrams, root, pour oral, time daily, and then today 0800. So confirm with the patient, can you swallow these at the same time? Yes. Okay, great. So bottoms up. And then he's going to take a drink of water. Awesome. Easy does it. Moving on to the last medication, which is going to be our fluticasone. Here, again, right patient, Thomas Smith, born 314, 19XX. Right medication, fluticasone, 100 micrograms, salmeterol, 50 micrograms, fluticasone, 100 micrograms, salmeterol, 50 micrograms, medication Lamar. And I did that the same for my lisinopril reconfirmation. My patient, right medication, right dose, 100 micrograms, 50 micrograms, 1 puff daily, that's the root, and time 0800. I will document all of this later. Okay, I'm going to instruct the patient on how to use this. Again, still explaining like what these are. Lisinopril is a antihypertensive medication. This one is going to be for bronchial relaxation. So yeah, bronchodilator. So how I'm teach a patient how to use this. I'm going to open this up, hear the click, push another button, wait for the click. It's going to crush the powder that's in there. Instruct them, let them know that this is a powder medication. This is a steroid, inhaled corticosteroid. And then I'm going to instruct them to breathe in, or to actually breathe out. Breathe out all that air, and then breathe in. And then I'm going to ask them to breathe out again, because I have not actually put this up to their mouth. Put this up to their mouth, have them breathe in. Hold for 10 seconds, 1 through 10, and then breathe out. And then rinse. Undo here. Rinse out their mouth. And then I actually neglected to do something beforehand. I actually forgot to clean this before I administered. So for the sake of simulation, I accept responsibility and full ramifications for my error, because I know that this is going to seriously expose a patient to an infection. If I fail the simulation for that, I understand. And once I have administered all my medications to my patient, I will confirm with them, are you okay? Anything more that I can get for you before I step out here and clean this up? no, thank you very much, and that ends the simulation. Please let me know if there's any feedback that you have for me. Other than cleaning off the tip of the heparin, I believe I hit all the steps, and I thank you very much. Hope everybody's staying safe, and have a great day.